So we're going to look at a 55 years old gentleman, case of C1-C2 rotatory subluxation. And he had a lower limb, bilateral lower limb and upper wing weakness since 2 years, which has aggravated since 2 months. And some of the classical findings, reflexes, hyperreflexity, it is a upper motor neuron lesion. So the hyperreflexia and all those findings you can see in this case classically. And we are going to look at individual reflexes and the findings and the clonus, right? So first of all, we are going to look at the lower limb reflexes. We are going to elicit the knee jerk reflex. As you can see, the knee jerk is hyperreflexive on the right side. Similarly, as you can see, knee jerk that is hyperreflexive on the left side. Now we are going to elicit the ankle reflex. Now what we are going to do is, we are going to elicit the plantar reflex. As you can see, plantar withdrawal with clonus. Now we are going to elicit a classical finding in the case of cervical myelopathy, that is ankle clonus. So what we are going to do is, we are going to relax the knees and we are going to suddenly dorsiflex. And as you can see, there is sustained clonus. When do we call it as a sustained clonus? When there are more than 5 clonus, sustained clonus. That is sustained clonus. If there are less than 5 dorsal and plantar flexion cycles, then it is ill-sustained clonus. Similarly, we will elicit the same finding. As you can see, it is a classical finding of sustained clonus. So now we are going to elicit the upper limb reflexes in the same patient. As you can see, the biceps reflex is hyperreflexive. Similarly, triceps and brachioradialis. So now what we are going to elicit is one of the classical sign which is seen in the case of cervical myelopathy. What we are going to do is, we are going to stabilize the middle distal DIP joint of the middle finger and we will observe. Just come on this side. So now we are going to elicit one of the classical signs in cervical myelopathy is the Hoffman sign. What do? We stabilize the DIP joint of middle finger. And just observe the thumb and the first finger and the index finger, the movement and the approximation at both these fingers. So I'm going to pinch the distal phalanx of middle finger after stabilizing the DIP joint. And as you can see, the classical Hoffman signs which is elicited in the left hand. Am I making sense? Okay, so now next what we are going to elicit is the patellar clonus. So we tap at the superior pole of patella with our index finger and thumb and look for the clonus. And we give downward thrust. As you can see, a little bit of clonus, I can feel it in my fingers. Maybe it would not be clearly visible in the video. See, you can see ill-sustained clonus.